So we're going to talk about Nava, which is neurally adjusted ventilatory assist. So again, this information was taken from the advanced modes of ventilation. So let's go up here to what is Nava. So this is a ventilation mode that uses a specific NG tube. And on that NG tube, there's sensors, right? So there's sensors on the tube and it detects electrical movement from the diaphragm. So let's go down here to look at the method on how this works. So you can only use this on the servo eye. It's the only one it's available on right now. So the special NG tube, it's called an ED tube. So there's electrodes on the ED tube that sense an electrical discharge from the phrenic nerve, and it allows the diaphragm to contract. So the diaphragm sends this electric nerve that the phrenic nerve picks up, and the sensors pick up, and that allows the breath to be given. So, and it's going to continue to give that breath until that electrical discharge is released. Okay, so over here, if you look, if it detects more electrical activity, that's when the ventilator is going to be giving more controlled breath because it assumes that the patient's having more work of breathing. And it will give less spontaneous breaths, right? So if it's a higher electrical activity, it's going to give more controlled breath. If it's less electrical activity, it's going to give more spontaneous breaths. So yeah, this is how that works, okay? So if we go over here to, let's look over at the settings. So this can be used in a number of different settings, right? Because it can actually be used in a spontaneous mode or non-invasive mode. In the neonate population is where you guys will see this. So you can have it in non-invasive. You'll have to set an FiO2, have to set a PEEP. If you have it in a control mode, then of course you're going to have pressure control settings and you're going to have volume control settings. So down here is why we might use this. So this is mostly the NICU patients, and it's mostly for spontaneously breathing patients. And this is a mode to prevent asynchrony with the vent and hopefully decrease the number of days on a ventilator. So that is it with Nava. You guys do need to be familiar with this one as far as how it works and when you would use it.